There was a large drop in labour force participation during COVID-19, and some of it was undoubtedly due to early retirement. But how much was due to a potentially more disturbing cause, a rise in substance abuse? Hello, Nezzy.
Hi, nice to be here.
Now, Nezzy, how big was the fall in labour force participation in the United States? Have we seen anything like this in other crises?
Okay, when the COVID-19 epidemic started in February 2020, the labor force participation for prime age workers, these are workers between ages 25 and 54, was about 83%. Then immediately by April 2020, it went down to 79.9%. That's more than a 3 percentage points decline. And then, we see a slow recovery. But even today, when we compare where we are with respect to where we should be, if the trend continued, that we show in our figure 1 in the paper, there's still a gap of 1.6 percentage point. That's a big gap. And how does this compare with previous recessions? I don't think we have seen anything like this. For example, if you look at the 2008 financial crisis, there was almost no decline in labor force participation. So there was a big, increase in unemployment, but even that was, half of what we see in the COVID. Also, COVID was much fast, decline was fast. And then, we see the recovery in a normal, in 2008 recession, let's say, unemployment rate, keeps slowly increasing, but there wasn't like a big initial impact. That's kind of unique for COVID. And the decline in labor force participation is particularly unique for COVID because we haven't seen anything like that before.
I've read some stories, seen some news items about how this story is older workers who just dropped out of the labour force, decided to retire a little bit early, decided it wasn't worth going back. What about this made you think that substance abuse, though, might be playing a larger part in this story?
Well, I think when we look at among the older workers, who are the ones not coming back, okay? So within the larger group of elderly, let's say above age 55, those who are not coming back are the ones with health problems, the ones that are relatively older, let's say above 65, ones with less education. I think these are people who felt like, for whatever reason, either the health reasons or the labor market prospects, they said, okay, it's not worth coming back. But we don't think substance abuse is a big problem for elderly, because when we look at like pre-COVID data, let's say 2015, 2018, when we have survey data, among everyone with, let's say, opioid substance abuse problem, only 3% were those above age 65. So overall, substance abuse is not a big deal for elderly people, and we think that them not coming back to the labor force has to do with health concerns, labor market. Whereas for the prime age people, substance abuse might be a bigger deal, and that's why we are focusing on them in our analysis.
You have to know, though, that there are more people who have problems with substance abuse. You can't directly observe it. You certainly can't directly observe it during a lockdown. So how can you estimate the number of additional substance abusers during a pandemic?
Okay, this is a concern because in order to diagnose someone with a substance abuse disorder, you need to ask them quite detailed questions. The main data source for this in the US is the National Survey of Drug Use and Health. It's an extensive survey, and we have very good data for pre-pandemic times, but these are yearly surveys, and it's not like we can really track down what's going on during the pandemic. What we know very well is the number of deaths due to substance overdose problems. We show in the paper, this is figure 2, that there has been an increase in the overdose deaths due to opioid or other substances. There's a trend, but then even when you take the trend into account, there was a big jump during the COVID. So now, when the number of deaths due to substance abuse overdose increases, this can be either there are new users, or existing users are dying at a higher rate. So there could be two different scenarios. Now, if we assume that the death rate because of substance abuse overdose did not change during the pandemic, then we can make a very simple calculation. You take the number of deaths, and then the number of deaths during the COVID period, the pre-COVID death rate, and that will give you how many new substance abusers you need during the COVID pandemic. So that's how we approach the problem. Now, you might ask, okay, did the death rate increase or not during the pandemic? Well, there are reasons to expect that it might increase. Maybe people switch to different type of drugs during the opioid, fentanyl, which is stronger and more deadly. You might think that maybe health services did not work well. On the other hand, if you look at the medical literature, there hasn't been a big disruption in the medical services provided to people with substance abuse disorder problems. And also what we see is that among people who die from, in the case of opioid, for example, opioid overdose problems, we see a larger fraction did not have any prior opioid disorder treatment. So it looks like there's a new group of people might be starting to use.
But many substance abusers, abusing alcohol, opioids, all these substances, continue to hold down a job. How confident are you that you can translate this rise in abuse into a drop in labor force participation?
Again, when we go back to pre-COVID data and to look at the National Survey of Drug Use and Health, we see that during 2015-2018 period is where we have good data, and we know that someone with a substance abuse problem has lower labor force participation compared to those who do not. In the case of opioids, for example, people with a disorder problem have about 13 percentage points lower labor force participation. In the case of meth, another drug whose use has increased during the pandemic, impact is even bigger. They have 16 per those people with disorder problems. They have 16 percentage point less labor force participation. So then our calculation goes like this. Okay, we have a certain number of excess deaths during the opioids crisis, during the COVID crisis, and then from that excess deaths implies a certain number of excess users or abusers, let's say, and then we know that abusers have a lower labor force participation, and that gives us a number to pin down to kind of calculate how much substance abuse during the COVID-19 crisis might contribute to the slow recovery of the labor force participation.
Well, let's put those numbers on it. How much of that drop in labor force participation do you think was due to substance abuse? And can we put a number of people on that?
So our calculations suggest that about 390,000 individuals are out of the labor force participation due to substance use disorder. A majority of this is due to opioid use disorder, and that's about 260,000 people. Now, you take this number, let's take the aggregate number, 390,000 individuals, and then you divide that by the gap that I mentioned in the beginning. Now we have this 1.6 percentage point gap, and if you divide that number of 390,000 people with the number of people that constitute that gap, around 19% of the gap that's still there can be due to substance abuse disorder. And again, this is assuming that the death rate during the COVID-19 from substance use disorder did not change.
We know from previous research that substance abuse tends to be more prevalent in less educated populations, those who have less well-paying jobs. So do we see the same in the drop in labour force participation, that it's concentrated in those jobs?
Yes, I mean, so we know, again, looking at the pre-COVID data, those without a college degree are about more than 3 times more likely to develop opioid use disorder. So that's a big gap between those without a college degree and with college degree. And when we come to that, LFP gap, labor force participation gap that I mentioned at the beginning, which was 1.6 percentage points for the whole population. If you split that between non-college and college, what you see is that for non-college, it was 2.4 percentage points. And for college, it was only 1 percentage point. That's more than twice. So the story seems to hold for when we look at, those without a college degree are more prone to substance abuse disorder, and the gap has been larger. Of course, one has to dig into this deeper, but in first impression, kind of concurs that the things go in the right direction. Things go together for when you contrast college and non-college.
And one of the terrible things about substance abuse is that it's once you are a victim of this disease, it's very hard to quit it, isn't it? So do you think this drop in labour force participation attributable to substance abuse? Is it a COVID-19 phenomenon that will go away, or might it last for longer?
Well, I mean, it's hard to make predictions, but here is we all know that substance abuse problem is persistent. I mean, in our calculation or in our analysis, we don't take a stand on like what led to a larger substance abuse during the COVID. This could be because people lost their jobs, maybe they were isolated. Our calculation is, whatever that increase was, we say, okay, if that, given that that increase happened, how much that affects the labor force participation. Now, one can imagine that, the recovery will be slow and maybe this gap will be persistent because exactly as you say, one can imagine that people with substance abuse disorder will have hard time getting out of this and coming back. But we will see.
Yes, well, we will see. It's very worrying, isn't it? And thank you very much for doing the research on it, Nazi.
Thanks a lot.
This is a really short but a really interesting paper. It's called Substance Abuse During a Pandemic, Implications for Labour Force Participation. And the authors are Jeremy Greenwood, Nezi Guna, and Karen Kopecki. You can download it using the link that's on screen now. Well, thanks for watching. We'll see you soon.